Welcome everyone to today's webinar. Thank you for joining us. And also thank you to CareXM for sponsoring today's webinar, which will go over the best practices in home health and hospice to achieve the Quadruple Aim. I am Home Healthcare News editor Andrew Donlin, and I will be moderating today's panel. We have two fantastic panelists with us here today. We have Laurie Nelson. A little background on Laurie. She immediately as a young child was drawn to taking care of the sick and wounded, and she dreamed of becoming a pediatrician one day. As time went on, her dreams led her to a more balanced career choice in nursing. She received her BSN from Wichita State University in 2001. Her first job out of nursing school was in a hospital intensive care unit. And then after 2 years of helping patients survive in the ICU, she made a career shift to hospice, where she found her love of supporting and empowering those who were taking their final journey out of this life. Today, Laurie is the the clinical solution specialist at CareXM. She's worked there for 12 years, helping providers integrate new technologies into the patient care processes, which improve both the patient and caregiver experience. Also on today's webinar is Christy Fisher. Likewise, very early in her education, Christy felt a kinship to healthcare, and in 2001, she earned her BSN from the University of Utah. Christy then worked for 2 years in oncology, and she was especially drawn to caring for patients whose lives were coming to a close. In 2003, she made the transition to hospice, where she's been helping patients and their families ever since. Working for several years as an on-site hospice nurse, Christy found an even more meaningful niche, which was providing telephone triage for hospice patients, where she's helped guide patients and caregivers through especially urgent and emotional situations. With her leadership and expertise, Christy has been leading CareXM's remote team of 90 triage nurses as a director of nursing since 2013, innovating in remote care while giving outstanding patient care. Guys, thanks so much for joining the webinar today, and let's get started.
Thank you for that introduction. And yes, Andrew, thanks for everybody here joining us today. We are excited to spend the next 45 to 50 minutes with you. And thank you for sacrificing your time. Today's objectives, we really want to just focus on maybe reinventing our mindset and how we can really have our operations parallel the quadruple aim. So why the quadruple aim? What we want to learn as far as best practices for, the healthcare landscape. We're going to talk about micro and macro practices that we can do, and we'd like to discover real world results from some of the practices we use and how this best practice can impact both the patient as well as the clinician experience. And he mentioned we are CareXM, and we've been in with the industry for a while, and our mission is to elevate the care experience. So hopefully we get a little opportunity to elevate your afternoon today. So thank you again for joining. So this is Laurie speaking. I guess since you don't know our voices, I'll let us know. I'm Laurie speaking, and we'll have Christy join in just a minute. Can you relate to this visual? This leader right here, full on mask, stethoscope, headache, stress. Can you relate to balancing our patient clinician experience in the home health arena? Our teams continue to be asked to do more with less. And I know I am preaching to the choir on this one, but with more cuts possibly looming, your thoughts may flow from how can I continue to grow and progress when I am expected to have more requirements for my company to meet for that reimbursement to be what it needs to be to sustain business, or if you try to do less or you skip a piece of a documentation, am I risking patient care? Am I risking reimbursement? Which then overflows to your balancing act of staffing and coordination. How do you find the balance of getting the most out of your team so that they are giving their best patient care around, but still finding ways to give those clinicians a break and make them set boundaries and have self-care time taken? So I'm assuming you can relate to what this leader may feel. So next question for you as a leader, what's your target As a leader, what are your business goals? As a business supporting home health, hospice, home care needs, what are your expected outcomes as you implement processes? Another question or two, are you meeting your patient needs and expectations so that your business can grow? Are you taking care of your clinicians so they can take care of the patients as well as take care of themselves? Do you have a target? Is the real question. Do you have a target and you just don't know where to start or what to focus on to reach that goal? Our goal today is to introduce you or remind you of the Quadruple Aim for healthcare. We will also be discussing our 10 best practices for achieving business goals. So let's start here. Some of you may know what the Quadruple Aim in healthcare is, and some of you may not know. If I'm totally honest, I just learned about the Quadruple Aim not too long ago. I think we all have the ability to reciprocate if asked, what are some of your healthcare aim goals? What are your outcomes? What are expected things you're expected to do? But I love this visual and putting it into a visual that you can relate to. We'll just put it that way. So you can see for us as a business, we have surrounded ourselves by the Quadruple Aim. Maybe you want to put your business name in the middle where CareXM is. Go ahead and do that so you can help relate to this. Quadruple Aim, here's what it is. It's the goal to have better patient outcomes in our care and our business practices. It's to elevate the clinician experience. It's to elevate the patient experience. And it's also to reduce some of those healthcare costs. And you can see it keeps going in a circle round and round because one impacts the other. So as CareXM, we have decided to surround ourselves and embrace the Quadruple Aim, and we hope that you'll join us in doing that. So we're going to send it over to Christy now to talk about some of the macro practices.
Hi, welcome everybody, and thank you for joining us today. So as Larry mentioned, we're going to talk about some of these bigger macro practices that overreach into different areas. You can see the 5 listed items that we'll talk through, and we'll just jump in and get started. I first want to talk about embracing the Quadruple Aim and kind of where it came from. Back in October 2007, the Institute for Healthcare Improvement, IHI, launched the Triple Aim initiative. It was designed to provide a framework for healthcare organizations as they were implementing and were always seeking better processes and addressing challenges and quality focuses, that they ensured that they paid attention to these outcomes, the outcomes being improving the patient experience. It doesn't really do any good to solve a problem if we're going backwards in the patient experience. Looking at better outcomes, improving the health of a population and making sure that what we're doing is improving things. We always want to look forward and getting better at things. And as you're doing both improving patient outcomes and you're improving the health of a population, at the same time you're doing that, you want to reduce and lower costs. That's always an initiative. It's always a challenge that we'll forever be dealing with, but it's something very important to do things better with better outcomes at a lower cost. And as we know, the U.S. spends a lot of money on healthcare. I think we are the most expensive per capita per person. And as we move as a nation and collectively into a more value-based care initiative, we need to ensure that we're embracing these outcomes and these practices to make it a more pivotal place for us to practice healthcare and continue to evolve. In 2014, the Institute for Healthcare Improvement added clinician well-being onto their aim. For those of you that are clinicians and leaders, this is kind of a no-brainer in my mind. We've been hearing nurse burnout or caregiver burnout or just the challenges in the workplace of people being asked to do more with less. It's a natural fit here because if you can improve the clinician well-being, you're going to better tackle those first 3 initiatives. So it overall sees better health both for the patient, caregivers, and for the clinicians, as well as improving the economy and things of that sort. So that's what the Quadruple Aim is, and as Larry mentioned, it's a cycle that we need to continue as we make changes and challenge ourselves to become better and adapt different technologies and modes of treatments and things like that, that these are at the forefront of our mind as part of the outcomes. The next macro practice I want to talk about is data, committing to use data. We've all been in a situation where perhaps we've had some staffing challenges. We're getting feedback from our clinicians and people saying we're just so tired. We've got so much coming at us, and in my world, it's call volumes and incoming calls from patients that need help, and they need it right now. And the gut reaction is to hire more people. Let's solve the problem by hiring more people. That's a really common knee-jerk reaction. But a smarter practice is to use your business intelligence to staff smarter. A lot of times it's getting to the root of the problem. It's understanding what is truly going on and peeling back the onion so that you can really make the best change for what your organization needs. In our world, we work with clients to look at their call volume and the analytics of why calls are coming in and at what speed and what time intervals, and it really can help validate some of the changes. So it may be here we're seeing this increase of call volume and things like that, and it can say, yes, we do need to hire somebody else, or it might just be, hey, we need to actually create a quality improvement project that will decrease the amount of calls that are coming in, but making sure you use that data and committing yourselves to slow down, pause, look at a bigger picture, and support your challenges with data behind that, and you'll make a better decision. If you go to looking at an equilibrium, in science, there's the constant equilibrium point where it brings stability. You have to have a constant, and you find that middle ground. You can't have too much or too little. For our purposes, the economic equilibrium is where market forces are balanced. So if you think of a clinical team and you want to know where you're in excess, where supply exceeds demand, you're overstaffed. It's costly. It's painful in that way for the leaders, because it lots of dollars get spent out there. You have too many employees for the amount of calls or patient visits or the needs that you have. And then when demand exceeds supply, we're understaffed. And this is probably more what we struggle across the board with, is we don't have enough staff to handle what's going on. We don't have enough employees to handle the patient calls or the visits or things like that. And it's negatively impacting both the patient experience and the clinician experience. So workforce equilibrium occurs where supply and demand meet. Picture, if you will, this visual model where you've got changing dynamics throughout time. At 8 a.m., you may have X amount of calls, and then at 10 a.m. it peaks, and then it goes back down at 2, and you're trying to constantly fluctuate and meet this equilibrium point, and it can be challenging. This is my world, where we work with clients to find solutions to better handle the patient needs, whether it's decreasing the amount of phone calls by addressing underlying issues, or whether it's working with a team of triage nurses that we have to backfill when the peak times and call volumes come forward. But it's all about finding that equilibrium point and using the data to drive where you can make those changes and be smart about it. One of our clients up in the Northwest, we've been partnering with for a few years, and they've used some of our health technologies in our triage team to help them with this, and their CAP scores went up 10 percentage points, and it's been a fun time working with them, because they've really seen a change in that, and they've really utilized the data and then followed up with changes in the technology that have been a really great resource for their teams, improving the clinician experience, but ultimately by improving their CAP scores, they're seeing that it's really improved their patient experience and what they're hearing from their patients. So that's been really exciting. One of the next practices we want to look at is the customer experience. AARP, and I'm sure you've heard this before, is as people are aging and we're getting more and more people in that elderly population, they want to stay in place. We're moving away from people going to the hospitals at end of life. Hospice movement is being more widely accepted. There's palliative care programs. There's all these different things that are being put in place to care for patients in their home, which is excellent, and it's exciting to be a part of that industry where we're seeing some of that. But on the flip side, the consumers, so the patients, the caregivers, even the referring providers, they're engaged more than ever before. They're doing their homework. You've got the CAP scores that are now on the Hospice Compare or Home Health Compare, and you can see what their patients and things are saying on their surveys. In addition to that, you've got people that are very tech savvy. They're looking at the Health MD ratings and the Rate MD, and there's all sorts of different ratings online that you can go and find that talk about what company's doing well, what practice is being happened, and those sorts of things. And as a business leader and as a practice leader, we're trying to really hone in on these experiences because they're becoming more and more important. You know, they want the convenience and quality and support. They want communication and personalization, and they can put those demands there because it's out there, and they have the ability to look at that and judge businesses based on that. So it's important as you're looking at evolving and improving your practice and making decisions that as you partner and make decisions, you make sure that you're partnering with somebody who has these same objectives, that's really wanting to improve the patient customer experience, because it's a super important metric that's becoming more and more apparent as time rolls on. In 2021, the PwC Health Research Institute did a survey, and 2021, there was 49% of business leaders who responded that prioritizing patient care was important, compared to prioritizing clinician care was 94% in 2021. And as we've seen the pandemic and some of those things come on, we expect 2022 is going to be higher, maybe even nearing 100%. This is a goal, and it's part of the fourth part of the Quadruple Aim, and it's something that we need to pay attention to. It's not in my lifetime. There's changes. Gone are the days where somebody comes out of college or something and goes to a business and stays loyal there and stays there for 20, 30, 40 years and retires with them. It's expected almost that you jump and you get different experiences with different companies, and a lot of this experience is great, but at the same time, it can be a challenge for businesses. And what you don't want to do is you don't want to lose people because of their poor working experience. We need to care for our clinicians. The burnout is real. I'm sure all of you can go on any online media and find forums and people that are just venting and verbalizing. I know the pandemic has really exacerbated that, but even before the pandemic, this was a hot topic, and it's becoming more apparent as we look at evolving healthcare practices and the focus that employers are looking at. We need to listen to the clinicians and help them understand and move forward with that. The national nursing turnover rate is now 40.5%. And you can see the statistics on there. The cost of just a 1% in our turnover is estimated to be about $270, $800 per year. That's expensive. You know, we're not, most businesses don't have the financial backing to really support that kind of metrics in their systems. And so we have to ensure that we're working smarter and that we're prioritizing the care of our people and doing what we can to listen to them and address their needs. We know that as the turnover rates go, that in coming years, it's just going to increase. The needs of additional nurses by 2030 is going to go up to 1.2 million. And we need to stop and think about that, because we hear that a lot. You know, it's been an ongoing thing that, you know, the baby boomers are getting older and people are having less kids, and are we going to have enough people to support them and things like that. So that's not a new concept, but think about it in terms of how are you going to address that in your business. We already have shortages with clinicians with COVID and things like that. it's not going to get easier, so it's forcing us to work smarter. But at the same time, we're having a focus on, we really have to pay attention to how we're caring for our clinicians, and we're preventing the burnout, and we're making sure that they're satisfied with what they're doing. In the healthcare industry, most clinicians are good about caring about people, but they're not so great about caring for themselves when it comes to burning out. And we as employers need to ensure that we're tuned into that to help them recognize and ensure that we prevent it before it happens. So the last macro practice we want to bring to your attention is embracing the new normal. So COVID, stretch pandemic, all those different things that have been going on for the last couple of years, we're kind of getting that COVID fatigue, kind of tired of talking about it. So I kind of want to talk about this as the new normal. COVID happened, things have changed, it's never going to go back to the same. We need to embrace this new normal. We've had a 38-fold increase use of telehealth. Telehealth was on its way up to being accepted and being more readily used well before the pandemic, but the pandemic has just catalyzed its efforts, and so it's launched it up into there. There are a lot of different technologies and things that can support healthcare organizations, and there's a lot of competing areas, which is actually really exciting because it's giving more opportunity. It's opening minds and options for business leaders to really launch into what can they do with their company to be in and compete in the modern times and really help healthcare reach that quadruple aim of improving patients' satisfaction, improving the overall health of our people, lowering cost burden, and at the same time, really looking out for the clinicians and their well-being and their experiences. Just to kind of give an overall view of what we talked about, these 5 macro practices, and we'll go into some of the details in the micro practices of these, but I really encourage you to look at these and determine where in your practice that maybe you're struggling, maybe where your pain points are, but where you could embrace one of these practices and really hone in and what the outcome could be. Perhaps it's something with your clinicians. Maybe they need to be help staffed a little better, or maybe they are needing a little less fatigue, and you can use some data or some practices that can improve that. Maybe it's looking at the patient experience. Maybe your CAP scores or different surveys or knowledge base on how your patients are experiencing are a little low, and you'd like to focus there. And I just suggest that you partner with people that can truly make a difference and support you in your aim to improve this, and make sure that they're a partner that recognizes the importance of the quadruple aim and that that's their goal as well, to help support you in this. So I want to pause for a moment and just take a quick poll question. And just on your screens, you'll get a question. If you want to just click on there and answer which would have the most impact for your organization. If you were to truly embrace the quadruple aim more into your practices, or commit to using more data when making important decisions, or look at targeting the patient customer experience as you make those decisions, targeting your clinical experience so that you're addressing your clinicians and their experience and looking at that, or adopting telehealth technologies and solutions. So go ahead and just click on the circle that you think would be most impactful to your organization, and we'll share the results here in just a moment, just to give you an idea of what your peers are seeing or feeling on this question. Okay, so the answers is, and survey says, 43% focused on the quadruple aim. And, I'm not surprised by that because it kind of encompasses a little bit of everything. Followed by the next one is targeting the clinician experience, which totally supports what we're seeing from the data that the clinicians, and perhaps they've been neglected in a sense, in that we focused really hard on the patient customer experience, and now we're trying to pull them up in the same category, because we realize how important they truly are and what an impact they make onto that. But it's interesting data to have here, and you guys will get a copy of this so you can see it later. You don't have to hurry and write this down if it's something you want to see, but it'll be part of the presentation that you'll have access to. But I'll just turn the time over to Laurie. She's going to go over some of our micro practices.
Excellent. And can you still see my screen, Chrissy? Just want to make sure. Or do I need to reshare?
Yep.
Okay.
Yep. Just put it in the presenter mode and you're good.
Okay, perfect. Okay, so we just talked about some macro practices, and when we were thinking of macro and how that impacts you, these are overall healthcare trends that we have heard for a long time, and they seem to be floating above us in everything we do, right? But then we wanted to also focus on some micro practices. Micro practices we felt like were the how. How can you accomplish some of the things that would impact some of these macros? So we're going to focus on the micros for a bit, and then hopefully apply them to the macros. So we have 5 micro practices we're going to talk about today. You can read the list here, but I will just quickly go through them. Optimizing workflows, providing a secure distributed communications platform, ensuring continuum of care, comfort, and reliability, ensuring you have a 24/7, 365 reliability and flexibility. And this can apply to all sorts of applications and processes you have. And then last but not least, utilizing a flex care approach, thinking outside the box to achieve your aim. So let's start with optimizing workflows. So how does this image make you feel? Does your heart rate spike a little? Does fatigue kind of set in, or feelings of being overwhelmed about getting organized or feeling productive in this environment? Can you relate to how this image might reflect some inefficiencies in your current processes or current workflows within your operations? We can feel this way at times in our workflows, right? Where you just feel like we are being completely inefficient in everything that we do. We're using inefficient processes, multiple systems to get to the same outcome. So we may use the sticky notes to follow up on certain tasks, or maybe we're using notepads for documentation, emails for care coordination, scratch paper to track visits or call volume. Maybe we're using Word docs or Excel sheets for graphs in our business analytics. And then we got to figure out how to get everything into the EMR in a patient chart. And how does that all work together? This is what it can look like when a business doesn't have a consolidated ecosystem addressing efficient workflows. And I think some of us can relate to this at times, and others, maybe you're never like this, and kudos to you, but I think we can all relate to this desk right now. So we're going to talk about a couple of things that are, we won't call them macros, but we'll call them things that we face every single day. So it should be no surprise that 50% of time spent by your clinicians is in charting and paperwork. This should not come as a surprise to those of you who have been the boots on the ground, right? I'd say the other 25% you'd add on might be driving time, depending on where you live. But 50% of time spent on charting. We came across a letter from a Portland area doctor who made some comments on this specific practice. And he put into print what we all feel like we experience, right? By using traditional methods, it takes about the same amount of time to document our visits as it does to make the visit itself. The inefficiencies of traditional methods compromise our time spent delivering the patient experience. So the frustration with having to toggle between multiple systems compromises our clinicians' joy with doing the work that they love. They love nursing, caring for patients, not paperwork. Nobody signed up for caring for others to do the paperwork, that's for sure. So what does it mean to optimize? a workflow. I think we throw this word around quite a bit, but I like to put a definition to what does it mean to optimize something. So when we talk about optimizing workflows, process optimization is the discipline of adjusting a process so as to optimize some specified set of parameters without violating some constraint. So optimizing, we're gonna discipline ourselves. Next comment on the optimization, a suboptimal process, think back to that messy desk, will never deliver the most efficient result possible. What process optimization can bring to your company is a way to reduce money, time, and resources spent in a process leading to better business results. So one of the things that we as a company appreciate about our mission is we help you as your partner find a care coordination platform or a solution that allows your team to care in one place, one system, for your team to really be able to care coordinate, improve efficiencies, and create that optimization. So I'm going to walk through an example of what it could look like to be inefficient. Now, one of the things that we can all relate to in home health and home care, hospice, is that everything starts with a phone call. And because we are, in a sense, caring for people in their homes, everything that comes to us typically comes through a telehealth form. So phone call, message, somebody is sending us information this way, right? So it doesn't matter what service you provide, phone calls are part of your daily life. So I thought we'd walk through what it looks like to take a phone call for one of our clients that we service. So the patient or caregiver calls in to the office, and they may or may not get an office staff member. Maybe they're going to get an answering service. Maybe they'll get a receptionist, whoever is answering the phone. So they're going to have that front line, right? And then this answering service or receptionist has to figure out a way to get a message to the person they actually want to speak to. So now that we have a person who is answering the phone call, the next layer, and this individual now has to figure out how to verify the patient information in a system somehow. Then maybe we have to go ahead and call that patient back now that we have the information, because they weren't still on the line. We had to go ahead and give them a call back. So now we're gathering the information up. So now we've got the information, we've decided that we've got to document that information somewhere, and then maybe we've decided that we need to escalate it to somebody else because at this point in time, I've done everything that I can as the triage nurse, but I need to involve the case manager on this one. So I need to see if they're working today. So I'm looking at an on-call schedule in another platform. Now that I've looked at the on-call schedule, I need to make sure I care coordinate my note, because this isn't like a visit record. Going into the EMR, I just need to make a paper trail, right? And now I need to send all of that information over to that case manager. And if I've got a great way to do it, maybe it's a message, but a lot of times if we don't have that communication, we may be making another phone call. So we make that phone call or communication to that visit nurse or the case manager, whoever that might be, and then they full circle call that patient back. So look how many touch points. I like to call this the octopus a little bit, because the poor team member has had to go into multiple applications, the sticky notes, the notepad, the email, the EMR, and then the Excel and graph, right? So let's now talk about a more efficient way to do something. So we referenced that 50% time charting. Well, there's no wonder that we spend that much time charting if we're touching so many different systems. So here is a better example of maybe a workflow. A patient or caregiver calls in through using a software solution technology. We're routing that call to the person who can help them the best the first time around. And once that individual receives that phone call, they have, because of a software situation, been able to look up the patient information and verify it in one spot. They've been able to triage that phone call or coordinate that care all in one ecosystem. They've been able to document all of their touch points at one point in time in this cloud of magic, I like to call it. And then they are now prepared to send that information back to the EMR and now pull that nurse back in by sending all of that information gathered in the one system out to that individual through a message or a phone call. Then that nurse can then go ahead and follow up, case manager as needed, and everything is coordinated together in these simple touch points. We make it sound so easy, but it is possible. If we really determine identifying where we want to create that optimization, whether it be through a person or a piece of technology, it doesn't matter. We provide opportunity to grow in our business and achieve those outcomes we've talked about. So, micro practice number 7, providing secure or distributed communications platform. We are no longer in the world where you can shoot an email with a patient's name to whomever, or just send a text message, or be talking about a patient over the lunch, the lunch that you're having with a coworker. That was the good old days, right? But now we are in a world where it's extremely important for HIPAA secure, compliant, distributed communication platform to coordinate our care. So a lot of times when we are trying to find a partner, or think about how can I make our team's life better by using coordination platforms, sometimes we think, oh, that's just another app at times too. But just know that there is value in finding a secure distributed communications platform. Team members can securely message each other with quick follow-ups about shifts or patient care. Phone calls can be instantly routed to individuals correctly or not at all if we're using secure messages. You can send a message, not interrupt patient care. And on top of that, the nurses, caregivers, home health aides, clinicians, everybody can focus more on the care and less on the stuff. So if you can think back of taking care of a patient in the good old days where you had to call me because you couldn't send me a message, I have to stop my patient care, grab that phone call. I've then been delayed in giving this good patient care, and I've interrupted this good patient care. So if we use secure distributed communications platforms, we can focus on patient care more and spend less time in the phone calls and the follow-up. A phone call to call somebody and relay a message could take 3 minutes. A secure message takes 30 seconds tops. So these tools can also help leaders stay more connected to your team members. They can be anywhere in your care area, and you can see who is available, working, and coordinate that care better. So micro practice number 8, finding real continuum or continuity of care, and then comfort and reliability. So why do we use comfort and reliability? Because you may have continuum of care, but how reliable are some of your solutions? So if you have a great continuity of care, when we talk about that specific to a phone call, patients can receive what we call first call response or first call resolution. So if go back to that first slide where we had the multiple jumps, that patient caregiver had to tell their story multiple times to the answering service or receptionist, to the triage nurse, and then to the visit nurse. Well, just think about using some solutions that allow you to first call resolution. That patient caregiver get their phone call routed to the person who can help them the quickest. Clinicians, if you're using software, you can get real-time information, up-to-date coordination, documentation, communication. You can reach patients, caregivers faster, and you're not using your emotion. You're not using your tired, emotional self to tell a patient's story. You're using the data to do that. When you have a secure platform, you can streamline your operations, you can reduce expense, maximize your reimbursements, decrease burnout, and just have quality improvement because you are tracking what your team is doing. So we're going to share a video with you about how using software or partnering with a vendor who has great software to help you do this can help impact your day-to-day care for your patients. So let's go ahead and show this video.
But having the nursing background and having a nurse the first time you call answer the phone to help with symptoms immediately has made a significant impact on the care that we're able to provide to our patients and families. And the continuity of communication then back via the report portal, we're able to see what happened all day long, in addition to the layer of support that our call center internally provides. It has significantly improved our communication scores.
Our scores went up 10 percentage points within a year. That's crazy. That doesn't happen.
You can see how many calls we're getting around end of life, the amount of refill requests we're getting after hours, how many patients need help with symptoms, or if there's a DME issue, and being able to have the ability for that transparency to go back and then work directly with the staff and put action plans together that flow up to our quality plan. Like, it's just so the transparency just allows for us to really tackle what our true problems are.
All right. Well, they say it better than I do. So how having a continuum of care platform has really impacted their business. So let's talk about micro practice number 9. So we are a 24/7, 365 business. There is no rest for healthcare, right? We can all relate to that. But there are times when the solutions you have in place, or the plans you have in place, or the processes you have in place are not sustainable in a 24/7, 365 environment. So ensuring that you have that reliability and the flexibility for the sustainability of a 24/7, 365 is extremely important in your micro practices from day to day. So we're going to share with you one more video of how one of our partners has also taken to heart this micro practice of ensuring the 24/7, 365 reliability. So let's jump to that video.
Our census has grown since we instigated CareXM, at least 60 patients?
Oh, at least, yeah.
Maybe more, which is 30% of our total census, at least. So, and we haven't had to increase staffing at night, and are still able to provide good customer service to patients. I was in a meeting with them just 2 days ago, and they were saying that they couldn't do their job were it not for CareXM now. It would be impossible because of the call volumes that we have.
They can be with the patient that's in front of them,
yeah,
knowing that other people calling are getting attention too.
Has been with us for 15 years, and she did telepage back way before we had CareXM, and she said, yeah, it's a completely different world, and there's no way they could do their job now were it not for that tool.
All right. I think they say it better than anybody else. So having the reliability and flexibility. So let's jump to the last micro practice, utilizing a flex care approach or a hybrid approach to achieve the aim. A lot of time in our business of home health, hospice, home care, we think that we need to either have all of the control within our own team because we are going to care for our patients the best, we're going to run our business the best, and that is the mindset a lot of times, and that is so true. But then on the flip side, when you think about some of the problems that can come with trying to keep all of it in-house, you go back to Christy's little hourglass equilibrium conversation. Sometimes you have more supply than you have demand, and that's just not sustainable. Or maybe you have more demand than you have supply, and you just can't catch up. So utilizing a hybrid approach where you keep some of the items in-house that you control, and then you have partners where you're able to help outsource some of your needs and create this hybrid flex care approach where you could have support with somebody who can help you achieve that quadruple aim. So a lot of times we think we have to do an all or nothing approach, but the beautiful part happens when you find that equilibrium. So finding a partner who can support you in that can help you with your nurse burnout, your staffing coordination, you're helping your caregivers, clinicians find balance. It can increase those scores, those reimbursements, your patient outcomes at the same time of lowering costs. So finding that sweet spot, that equilibrium is the goal. And I think as healthcare continues to transition in its new normal that we've addressed, we will continue to see the trend of blending in-person and virtual care with new technologies. Gone are the days that everything has to happen in the patient's home. You can blend that in-person, virtual technology solutions to your everyday practices of great patient care. So let's just end with summarizing again some micro practices that will have impact to the clinician and the patient. So our 5 micro practices, you can see that the optimizing workflows can impact the clinician and the patient experience, the care coordination platform, the continuity of care, the 24/7, 365 reliability, as well as flexible solutions. Both of these, clinician experience and patient experiences, are impacted dramatically by these micro practices. So we're going to have one more poll and ask you these questions. When you are thinking of what micro practice you rank as the most important to you and your business right now, would it be A, optimizing workflows, B, secure communications and coordination platform, C, continuity of care, D, 24/7, 365 reliability, or E, flexible care to achieve the aim? So go ahead and take a moment to answer, and we are anxious to see what your answers are. All right, so it looks like we have some poll results. Christy, do you have the visibility to share what that is, the results?
Sure. Yeah, so optimizing workflows, 41%. Secure communications and coordination platform, 15%. Continuity of care, 15%. 24/7, 365 reliability, 9%. And flexible care to achieve the aim, 21%.
Excellent. I think we can all agree that working smarter instead of harder is sometimes the best practice. So let's go ahead and end here. Is that sharing again?
Yes.
Okay, and are
Not
we on the
presenter
aim?
mode, but yeah.
Okay, perfect.
Yep.
Sorry.
Yep.
So let's just end here with this beautiful image of, and put your business name in the middle. How are you going to achieve the quadruple aim? Achieving the quadruple aim impacts better patient outcomes, elevated clinician experience, elevated patient experience, and reduced healthcare costs. Knowing that each one impacts the other, how are you going to achieve some of those things? So we are going to go ahead and open up to our question and answer period right now. So Andrew, we'll turn the time back to you for those questions.
Yeah, guys, thank you so much. First of all, I thought a lot of that information was great, and it was awesome to see the audience interact with the poll questions. One thing I know our audience wants to know is, what are some of the roadblocks to implementing these best practices? You know, we went over a lot of the best solutions and practices and where our minds need to be moving forward, but what are some of the roadblocks that might come up?
I can take this one, Laurie. But I would say some of the roadblocks are going to be surrounding by fear of change, fear of changing with your staff and communicating with them, integrating with other platforms and what the implementation process is like. And so those can be roadblocks. And so you just want to make sure that as you're looking at these changes, that you're working with a partner who can partner with you, that understands and has those same expectations or those same goals as you, so that you can align smoothly and they can support you, that they have clinicians that are helping to help your clinicians as they coordinate and overcome some of those roadblocks, because fear of change can be a big challenge, but oftentimes you can overcome that by having people that have similar backgrounds and situations that can help ease that implementation process.
Yep, that makes sense. And then what makes the most impact, would you say, to both the patient and clinician experience?
I'll go ahead and take that one. I think for me personally, I think some of the biggest impact that can happen is when individuals are allowed to do what they're meant to do. So when we talk about clinicians, they will have the biggest impact on caring for individuals because that's what they chose to do in their career. When you think of, say, the top 3 reasons people love their job, it's typically not money, right? It's feel like one of the number one things is feeling like you're making a difference. So if I, as a clinician, feel like I'm making a difference and having impact on patient care, I find more joy in the journey, right? And as a patient, when I feel like my caregiver has my best interest and my best story, my healthcare story in and is focusing on my care, I can either heal faster or hospice. My journey towards the end of life is so much better when my clinician is giving the best patient care. So by really elevating that clinician experience so that they can do what they are meant to do, which isn't paperwork and phone calls and all those things that come with the job, right? But focusing on the patient care, it will impact, I think, all of the other portions of your quadruple aim when that clinician has a better experience.
Okay, fantastic. Well, thank you everyone for listening in today. And thank you again to CareXM for sponsoring the webinar and bringing in our audience to give them some insight into all of this. If you want follow-up information, if you didn't get the chance to ask a question, you can reach out to CareXM directly, or you can also email me at adonlan, adonlan, at agingmedia.com, and I'd be happy to connect them with you or on any other specific questions regarding today's subject. Thanks again, everyone.
Thank you, everyone.
Thank you.